Today, I just want to discuss about the aortic stenosis. I don't know, moreover, it's a surgical topic rather than a medical with a medical problem. So, can you go to the next slide, Dr. Lavanya? Hello. Yeah. So, as you all know, we know the basic cardiac cycle. As we all know, from the left ventricle, the blood flows into the aorta, and from there it gets pumped into all the major vessels and into the various parts of the body. So, if there is a problem with the aortic wall, so if, as we all know, from the left ventricle, when the blood is flowing to the aorta, when there is a problem with the aortic wall, that is what we call as the stenosis. It is nothing but the narrowing of the valvular orifice. So, from during the LV, when there is a problem during the time of systole, when there is a problem with the orifice, what happens? The entire blood, it actually forces back into the LV. So there will be a huge pressure buildup in the LV, which actually leads to the LV dysfunction. That is the main problem with the aortic stenosis. So when you are dealing with an aortic stenosis, you are almost dealing with a patient of a LV systolic function. Next slide. So this is a normal aortic valvular area. Usually we call it as it looks like a Mercedes-Benz sign. We call it as a Merc-Benz sign. So most of you may be knowing what is a Mercedes-Benz sign. So this is a tricuspid wall where it looks like a Mercedes-Benz sign. So the narrowing, usually the normal surface of the aortic valve is around 3 to 4 centimeters square. And the narrowing of the aortic orifice, usually we say it less than 1.5 centimeters square, is called as the aortic stenosis. Okay, next slide. So the major causes of the aortic stenosis remaining all like radiation exposure, congenital, systemic lupus erythematosus, infectious endocarditis, or rheumatic heart disease. These are all the other causes. But the major problem is due to the deposition of the calcium due to the atherosclerosis. That is a fibrocalcific deformity of the aortic wall. So the main problem is the calcium deposition on the wall, which leads to the aortic stenosis rather than the other problems. So remember, aortic stenosis most probably occurs in the old age people, basically due to the atherosclerosis. Next. So if someone asks you the cause for it, the first cause will be the atherosclerosis. That is a calcific deposition. Okay. Symptoms initially, the patient will be asymptomatic unless and until you do an echo. Usually, you may not be able to find out that there is a problem with the aortic stenosis. So, usually the patient complains only with that there is a decreased exercise tolerance. Otherwise, the patient does not have any symptoms related to the aortic stenosis. Over a period of time, only the patient develops the other symptoms. But initially, the patient doesn't have any symptoms. He doesn't have even breathlessness, but only during exercise, there may be some problems. So the symptoms start only when the aortic wall area is less than 1 centimeter square, or if there is a concomitant other heart disease like a coronary artery disease. So systolic BP is also present, but not usually more than 200, and they don't have also, and even if you do something, and they have a hypertrophic cardiomyopathy, which actually because of the back pressure on the LV, there is an enlargement of the heart, which leads to the hypertrophic cardiomyopathy. Next. So these are the symptoms usually after once the aortic valve is narrowed. As I told you earlier, usually earlier it will be only an exertional symptoms, but when sometimes it may be presented with exertional angina, exertional syncope, heart failure, and arrhythmias. And these are the symptoms which actually are the indications for the patient that he has to undergo the management for the aortic stenosis. And the signs, as you all know, pulses tardus, that is slow rising pulse felt in the carotids due to prolonged ejection phase. Because of this LV problem, and there is a stenosis because there was a back pressure in the LV. The ejection phase is prolonged because the LV is not able to pump the blood easily. Because there is an ejection phase prolongation, there will be slow rising pulse in the carotids. This is called as pulses tardus. And also the systolic BP will be low after some time, because see, initially I said the systolic BP is the high. That actually happens in the early stages because of the stenosis. But when the stenosis increases and when there is a problem on the LV and when the LV fails, then there will be a low systolic BP and there will be a JVP will be normal, and you can find the systolic thrill in the carotids. and systolic murmur in the aortic area as expected, and there will be a heaving apical impulse. And initial stages, you may not be able to find any cardiomegaly. Next. Murmur, usually we describe it as a murmur as per the site. It's in the aortic area, right second intercostal space, radiating to the neck through the carotid arteries, and ejection systolic murmur. And it will be harsh, and position to hear it is in the leaning forward and held in expiration.